Okay, so let's talk about then, because we just showed you a slide of memory. So what kind of memory stays stable with age? So that means we don't see a lot of changes with this type of memory, okay? So as we age, this memory tends to kind of go right along, pretty, stable in its abilities. And so recognition memory. So recognition memory is the ability to remember something with cues. So what does that mean? So that means that if you go to the grocery store and I tell you, what's your list? What are you bringing? Or what are you getting at the grocery store? You may not remember. But if I say, but you're making blueberry pie, so what are you getting at the grocery store? You'll know exactly what you are there for. So cues is important in being able to recall these kinds of spontaneous lists. The other memory that tends to stay stable is temporal order memory. So these are kinds of memories that we have of sequence of events. So for example, today I was kindly invited by Dr. Poon and Marie to join them for lunch. And before that, I was at a meeting on campus. And then before that, I was home walking my dog. So it's this ability to sort of remember sequentially the order of these events. And then procedural memory are the kinds of memories that we talk about that are like, I think people refer to it as muscle memory, right? So if you played music, if you played violin or piano or some type of instrument, you're not likely to forget how to play the music. If you ride a bike, if you learn to ride a bike, that's all part of procedural memory. And that tends to stay stable. But in terms of declines in memory associated with normal aging, so these are normal declines in memory associated with aging, we see that there are declines in our ability to engage in delayed free recall. So this is, again, spontaneous kinds of retrieval of memory without cues. So cues are very important. So if, again, you're at the grocery store and I ask you what that list is, without cues, this will tend to be more difficult as we age. So cues are very important. Understanding the context. If I was going to the grocery store and I knew that a family member who was a vegetarian was coming to my house, and I needed to make sure that I got all vegetarian groceries, that would be a cue for me to remember what kinds of items I need to obtain. Source memory. So these are memories where we try to remember who told us this, right? So where did I get that information? So this also, over time, as part of normal aging, can decline. So remembering if you learned a fact because you saw it on TV, or did you read it in the newspaper, or did you hear it from the news? So being able to recall where you obtained that information can be difficult as we age. Okay, so that tends to also decline with age. And then prospective memory. This is memory where we're kind of thinking about the future, right? Thinking about what we have to do the next day, or what we have to do next week. That also declines with age. So remembering to take your medicine, let's say, before going to bed can decline with age. That can be more difficult as we age. Remembering an appointment. So we do many things to try to remember that. So we use cues to help us remember those kinds of. But really the point I'm saying here is that as we age, we do have normal declines. And if any of us are experiencing this, this is all quite okay. This is part of our cognitive functioning changing. And so how do we identify changes in cognitive ability as we age? So I mentioned to you as a psychologist, one of the ways we do that is through evaluations. So neuropsychological evaluations. So I'll look at, for example, pre-morbid functioning. So this is what was your level of functioning prior to you coming in here with some of the complaints that you're experiencing. So what was your educational background? What did you do? What kind of work did you do? That's a good kind of indicator of what you're capable and able to do prior to the current cognitive changes that are distressing for you that you're experiencing currently. And I would also assess for these cognitive domains that I mentioned to you, memory, attention, processing speed. I'd ask things about your symptoms. Of course, very important to get input from family. I'd look at your psychosocial functioning. To what extent are these cognitive changes affecting your routine, the kinds of daily activities that you engage in? I'd also, so important, want to look at your medical history. Are there some things that might be explaining what's going on, right? So we need to rule out medical history, depression, anxiety. All these things can really impair your cognitive functioning. So, and this is treatable. We can treat a lot of this. So I'd want to know about this. So these are some of the areas that we'd be assessing as part of the neuropsychological evaluation. So early identification and diagnosis is important. And so I want to point out, there's a handout that you all have received. And it's the one that says 10 warning signs of Alzheimer's. Okay? And this is actually from the Centers for Disease Control, CDC's guidelines, that I've printed out and distributed to you all. And so, according to CDC, that these are some of the warning signs that might bring you in to be evaluated. So, memory loss that disrupts daily life. So, forgetting events, repeating yourself, or frequently relying on more aids to help you remember. The key thing is it's disrupting your daily life, okay? So this is the impairment, and I can't say enough how important that is in making the determination about what's going on. Challenges in planning or solving problems, having trouble paying your bills, or cooking recipes you've used for years. Difficulty completing familiar tasks at home, at work, or at leisure. Confusion with time or place. So having trouble understanding an event that's happening later, sort of feeling disoriented with time and place. New problems with words and speaking or writing. Oh, let me see, I'm off on this. Let me just see if it's on my next slide. Right, there it is. Okay, new problems with words and speaking or writing. So having trouble following or joining a conversation or struggling to find a word you're looking for. Misplacing things and losing the ability to retrace your steps. Decreased or poor judgment. Being a victim of a scam. Or maybe not managing your money well. Paying less attention to hygiene or having trouble taking care of a pet. Withdrawal from work or social activities. And then changes in mood and personality. These are early warning signs that often lead to someone requesting an evaluation. But what I want to say is that early identification can lead to early intervention, right? So there are a lot of benefits, and this is the second slide, or the second handout that I gave you. The benefits of early diagnosis. So getting an accurate diagnosis is important. So once we understand what might be going on, we might be able to make recommendations that can help reverse the condition. Being actively involved in your healthcare and personal decisions can also be a benefit. Being proactive about medications, using medications effectively. If we know early on, maybe what we can do is some of the symptoms you're having are more depression related, so let's treat the depression. Focusing on what's important. So early diagnosis enables you to focus on priorities that are important to you. Making choices is empowering. Taking advantage of resources and the community. Engaging our families to support us. So when we have an early identification, we can rally our families to support us. Advocacy. Advancing research and reducing stigma. So this handout just lists some of the benefits of early intervention and early diagnosis. So what's my take-home message today? So here it is. As we age, our cognitive abilities will change. Okay? It is part of aging. Our cognitive abilities will change. Some will decline over time, and some will stay stable, and it's normal. However, cognitive changes that become more concerning and that cause distress for you. So that subjective experience of distress, something's going on, this is not right. Trusting that. And maybe some impairment should be identified and addressed. And if we identify these troubling cognitive changes early, we can either change their trajectory, maybe even reverse it, or ensure that we can access necessary resources and supports. So knowledge is power, and my hope is that this information empowers you to have compassion for yourself and others as cognitive changes occur as we age, to trust yourself. So when you're experiencing these changes and your concern grows, to trust yourself that maybe I need to be evaluated or talk to someone about these changes, talk to my doctor. And knowing when to seek help to understand these changes and to also get the support and advocacy that can strengthen your resiliency. So thank you, and happy to answer any questions. Yes.
Some of us have stayed with our physicians forever and ever. Some of our physicians are starting to get towards retirement time. And we go to see our physician and actually come out worrying about our physician.
Maybe you can give him the handout. And
I'll tell you some instances, and I'm worried about them. How long can these people stay credentialed and still be in practice and getting on? And as I said, one of the issues why in the practice, well, some places go and something to do. And I thought, I'm concerned about that.
yes.
So, do we do anything about that?
The handout would be a good first step. You know, I actually just came from a trip with my father, visited my dad this weekend. This is actually a very recent picture of my dad and I. My dad is 86 years old in Chicago. And I was trying to find out some information, or actually trying to get him a cell phone because he decided he wanted an iPhone. And I looked at, I needed his driver's license. So I looked at his driver's license, and he had just gotten it renewed like two years ago in 2021. Or no, 2020. And it's due to expire and be renewed in 2023. So what I noticed is that how how quickly or how short term these renewals are now for him. And so I imagine that for things like licensure, there needs to be sort of more regulation around that. Just to, now my dad probably could drive till he's 100. He's such a great driver. But anyway, but there is more monitoring. I noticed that with him, again, it's in 2 years, he has to go back and be reevaluated for his driving. So I think that with many kinds of licenses, there may be, like, you know, as a provider, there should be probably more regulation around that. I agree. Yes?
Is a person likely to have a cognitive decline in an area where they were not particularly strong? For instance, verbal usage or time management. Is that likely to be an area where there could be more decline?
So our verbal ability tends to be probably one of our most resilient functions that tend to be sustained as we age. So, it's probably not as vulnerable to the other, like memory and language and those other functions that we've talked about. So, if somebody has you know, maybe relatively weaker verbal ability, there would be no reason why, unless there is, you know, some other underlying acute problem, that they would decline more in that area. That tends to be held up pretty well. So whatever verbal ability we have, in fact, what we see is it actually grows. Our ability, our verbal ability, and our ability to sustain our knowledge and verbal skills tend to improve over time. Yes?
One of the things that I think is true about healthcare as we age is that we do see physicians early and often. Is there any advantage becoming a patient in a neurological center in order to establish baseline data for the individual?
So,
you did point out that one of the tricky parts of all of this is accurate diagnosis.
absolutely. And so what will happen? So the question is should you meet with a neurologist and get a baseline? So first of all, the neurologist is specialty care, and so you'll need a referral to see a neurologist, right? And usually that comes from your primary care physician. And usually the reason for the referral is because of some kind of concern that your PCP might have that would be helpful to get a neurologist to weigh in on. And so in those situations, it would be helpful. If you're noticing cognitive changes that are becoming more distressing or causing some impairment, certainly I think definitely talk to your doctor about it, and then see if you can be evaluated by a neurologist to sort of get sort of a baseline functioning of those changes. Now, the neurologists will do medical procedures, but will not do testing, not neuropsych testing. Okay, and then the benefits of neuropsych testing is we actually assess all those different domains, and we can over time follow you to see if those cognitive functions change over time. So we actually have data to be able to kind of map those changes over time. So I don't know if that answers your question. So yes, if you are, certainly you'll need a referral and getting that. But if you want to get a true baseline of your cognitive functioning, you know, getting a cognitive screen or cognitive evaluation is also a good way to get that information. Yes? Sure.
You or somebody in our area is offering that screening now? I mean, the DNA thing, you have to go to every court.
Mm-hmm.
So it's not even screening, is that
Okay, no, that's a good, and maybe we can have Lisa come in and address this more specifically, okay, because I'm going to give you sort of my understanding of what she's able to do. So what we know with some of the testing is that diet and what we call sort of brain supporting nutrition, right, to keep your brain healthy, right, diet is so important. And the eye test you're doing is looking at your diet. And we know that diet can impact your cognitive functioning, right? We know that glucose and B12s and Bs, vitamin Bs, and different lutein, which is what she's evaluating in the eye test. All those are an indicator of how good your diet is. And diet, and good diet, is highly correlated with good cognitive functioning. Now, is there a causal? There are many factors that influence our cognitive functioning, diet being one of them. But, and so that is one indicator that you are having, you have good nutrition, that you're eating your kale and your spinach, okay? And we know that if you have that good nutrition, you will be healthier. Because all this mind-body stuff interacts, right? It's all connected. So what you do with your body affects your mind, what you do with your mind affects, so they're all gonna make a healthy environment for you. Now your question about evaluation. So yes, so we are currently doing that here in Athens at University of Georgia at the Cognitive Aging Research and Education Center. So we are doing evaluations as part of service to the community and outreach. And so not only do we do education research, but we do the neuropsychological evaluation. We do the diagnosis in collaboration with a team. So we have a team. We have Dr. Scott, who's coming to talk to you next month, and he is a geriatrician. We have psychology, neuropsychologists who help with the evaluation assessment, and all together we can create an understanding. I can't say that we always have the answer about what's going on, but certainly we'll have some baseline information that can help you and inform you about your cognitive challenges that you might be experiencing and making recommendations. And then we also have, as part of CARE mission, is the support and intervention piece. So providing support for individuals that might be having, individuals and their families that might need some support around their cognitive functioning. I see a hand up, yes?
Could you comment on how big a role spirituality plays in mental health?
A big role, right? So we know that faith and spirituality can not only affects our mental, our emotional experiences, but also when we're good emotionally, mentally, that obviously results in a better health, better diets. I mean, all these things are linked, right? So if I ask, so for example, let me give you an example. So Lisa asked you all to take the spinach challenge. I like to call it spinach and kale challenge because kale is so good for you too. So if you can't handle spinach, try kale. So take that challenge. And what's going to happen if you dare to take that challenge? You are going to see that other changes happen in your diet. Okay, so what we know from research, as you change one thing, other changes happen. Other kinds of what we call healthy behaviors happen. So changes in your diet can affect changes in your overall nutrition. And you might find that you might start exercising more too. Right? So once you start introducing kale, you might find that you're walking more. Seriously. I'm not saying that. This is based on research. Health behaviors, it all changes. So if you can just change one thing, you find that other things change. It's just inevitable. You think, oh my gosh, if I'm going to do this, I'm going to make healthier choices. And so yes, all these factors, all these changes we make, spirituality, our faith, can, in other literature, it's very protective, right? So it's a way to cope with stress. So stress is a problem, and chronic stress is a problem. And spirituality can help us manage the stresses that we experience, because we believe that there's something higher and bigger. Yes?
So what training or skills does the average primary care physician have to be able to make an initial referral?
Unfortunately, there's a lot of variability in your primary care physicians. In fact, there was just a survey that came out that looked at your primary care physician and their comfort in being able to evaluate and identify mild cognitive impairment. So not even just mild cognitive impairment. So I have to say that there's just a lot of variability in that. Some PCPs will give you a screening evaluation. Some of you may be familiar with some of these. The mini mental is one. MOCA is another one. These are screens that are used oftentimes in primary care settings that give you a score of your cognitive functioning, but it's a screen, right? It's a screen. And really, to better understand what's going on, so there's cutoffs. So if you fall within this score, this is fine, you're fine. If it goes within this range, then you're showing mild. This range, you're showing moderate, and then severe. So we can actually, based on this screen, kind of make, but I wouldn't make a full diagnosis based on that. And I wouldn't let a PCP, if I had a family member, if my dad was going into PCP and they did the MOCA screen and said, okay, you have Alzheimer's, I would say no, right? I would say no. I want to know more about what's going on. So that will happen, so be careful when that happens. Oftentimes, so I'm not saying that many PCPs I also know will then say, okay, let's see a neurologist. And that starts the steps, right? So then you get a referral to a neurologist. And the neurologist might say, let's do a neuropsychological evaluation. Let me reach out to my partners over at CARE and see if we can do a neuropsych evaluation. So that just starts the steps to getting fully evaluated. Yes?
You're so well schooled. You have experience. You know what to eat, what to do, everything. So my question is, do you, and I don't know exactly where you're on the scale, but I do have a 20-year-old son. 23. 23. And do you ever go to the pantry and forget what
all
you
the time? Yes. And I stare at it for a while. Yes, and I stare in there going, what was I here for? And I have to backtrack sometimes. And now I can still retrace my steps. And I will sometimes retrace my steps. But yes, that happens. Yes, yes. Uh-huh.
I think I should make an announcement right now with regard to the question that was just asked. Premier Health is coming to UGA here. And it was announced yesterday, not in time, I think, for a lot of people to know about it. Their program starts at 3:30. And, oh, it was canceled? Well, anyhow, it's still a good announcement because
that's right.
Have been neuropsychology. And we're
Yes.
going to be able to use their services.
That's wonderful. That's great. I think that once word gets out that it's important to do early identification, I think evaluations will be in need. And I think it can be very helpful and informative. So let's hope Premier Health will be able to come back and be here. There are other neuropsychology evaluation sites in the community. And so if anybody's interested, I'd be happy to share some of that information. Yes?
Would you say that the neurologists here in Athens are familiar with your program here at UGA?
They are getting familiar. So we are pretty new. Okay? So we really just didn't get up and running until spring of 2021. Actually, maybe 2020. So spring of 2020. and even then, we were slowly, we were seeing very few clients at the time. And so now we're working more closely with neurology, and they're becoming more aware of these services. Yes?
I mentioned it to my neurologist, and he never heard of it.
Yeah. So Athens Neurological Associates is the neurological center that we work with. If there are others, at this point, we haven't done. We have not been working with other neurologists, just the neurologists at the Athens Neurological Associates. Mel?
I think it's okay to do this, but I would like to provide testimony as to the value and extraordinary detail that the neuropsych evaluation can provide. My wife and I have been going through some of this in the last year or so, and I'm a scientist, and I'm still floored at the detail that they can provide and the guidance that they can provide in terms of steps you can take to kind of deal with what's going on. So don't be afraid to do it. We were afraid to do it, but do it, and I think you'll find that it's very, very bad. This lady is extraordinary.
Thank you, Mel. Thank you.
Well, if there's no more questions, thank you so much.
Thank you, Dr. Poon. Thank you all for being here. Really? Oh, thank you. I hope I answered the questions that